evening, ma'am. My name is Karen Salvatera, a Best Entry student, and today I will be administering medication through intradermal injection.
Gather all materials needed. Check each medication order against the original physician's order according to agency protocol. Clarify any inconsistencies. Check the patient's chart for allergies. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. Perform hand hygiene. Move the medication cart to the outside of the patient's room or prepare for administration in the medication area. Prepare medication for one patient at a time. Read the MAR and select the proper medication from the patient's medication drawer or unit stock. Compare the label with the MAR. Check the expiration date and perform calculations if necessary. If necessary, withdraw the medication from an ampule or vial as described in the previous skills. When all medications for one patient has been prepared, let's check the label with the MAR before taking them to the patient. Lock the medication cart before leaving it. Transport medications to the patient's bedside carefully and always keep the medication in sight. Ensure that the patient receives the medication at the correct time. Identify the patient. Usually, the patient should be identified through checking the name and identification number on the patient's identification band. Ask the patient to state his or her name. If the patient cannot identify him or herself, verify the patient's identification with a staff member who knows the patient for the second source. Close the door to the room or pull the bedside curtain. Complete necessary assessments before administering medications. Check allergy bracelet or ask patient about allergies. Explain the purpose of the medication to the patient. Perform hand hygiene and put on clean gloves. Select an appropriate administration site. Assist the patient to the appropriate position for the site chosen. Drape as needed to expose only the area of site to be used. Cleanse the site with antimicrobial swab while wiping with a firm circular motion and moving outward from the injection site. Allow the skin to dry. Remove the needle cap with the non-dominant hand by pulling it straight off. Use the non-dominant hand to spread the scene taut over the injection site. Hold the syringe in the dominant hand between the thumb and forefinger with the bevel of the needle up. Hold the syringe at a 10 to 15 degree angle from the site. Place the needle almost flat against the patient's skin, bevel side up, and insert the needle into the scene so that the point of the needle can be seen through the skin. Insert the needle only about 1/8 with entire bevel under the skin. Once the needle is in place, steady the lower end of the syringe. Slide your dominant hand to the edge of the plunger. Withdraw the needle quickly at the same angle that it was inserted. Do not massage the area after removing needle. Tell the patient not to rub or scratch it. If necessary, gently blot the site with a dry gauze square. Do not apply pressure or rub the site. Do not recap the used needle. Engage the safety shield or needle guard if present. Discard the needle and syringe in the appropriate receptacle. Assist the patient to a position of comfort. Remove gloves and dispose of them properly. Perform hand hygiene. Observe the area for signs of reaction at determined intervals after administration. Inform the patient of the need of inspection. Document procedure to patient's chart. Identify the appropriate landmarks for the site chosen. Clean the site with antimicrobial swab while wiping with a firm circular motion and moving outward from the injection site. Allow the skin to dry. Remove the needle cap with the non-dominant hand by pulling it straight off. Grasp and bunch the area surrounding the injection site or spread the skin taut at the site. Hold the syringe in the non-dominant hand between the thumb and forefinger. Inject the needle quickly at a 45 to 90 degree angle. After the needle is in place, release the tissue. If you have a large skin fold pinched up, ensure that the needle stays in place as skin release. Immediately move your dominant hand to steady the lower end of the plunger. Avoid moving the syringe. Inject the medication slowly at a rate of 10 seconds per milliliter. Withdraw the needle quickly at the same angle as it was inserted while supporting the surrounding tissue with your non-dominant hand. Using a gauze square, apply gentle pressure to the site after the needle is withdrawn. Do not massage the site. Do not recap the used needle. Engage the safety shield or needle guard if present. Discard the needle and syringe in the appropriate receptacle. Assist the patient to a position of comfort. Remove gloves and dispose of them properly. Perform hand hygiene. Evaluate the patient's response of the patient to the medication with an appropriate time frame for the medication. Document procedure into the patient's chart.